Hi, everyone. Thanks for joining me today. I'm Madeline Heim, health and science reporter for the Post Crescent and USA Today Network Wisconsin. And we are back for our second week of Newsmakers Coronavirus Edition. And we've got a guest here that I'm really excited to talk with, Julie Willems Van Dijk, who is the Deputy Secretary for the State Department of Health Services. But before we jump in, I just wanted to refresh everyone on where we are right now. So last Thursday, Governor Tony Evers extended Wisconsin's stay-at-home order, which has been in place since March 25th. He extended it to May 26th. And this is about a month longer than the original order, which was set to expire this Friday, April 24th. So schools will be closed for the rest of the school year, but a few portions of the order have been relaxed a little bit, including golf courses. And you can find more information about that on our website. But most recently, Republican lawmakers have challenged the new order in court, so we'll have to wait and see where it ultimately stands. But what I want to talk to you about today, Julie, is sort of what comes next from the public health response perspective. And so the governor said last week that two things really have to get ramped up for the state to be able to reopen, and that is testing and contact tracing. So I have some questions for you about that. But first, I actually wanted to start with a question for you based on your prior role. So you were previously the director of county health rankings and roadmaps, which I would imagine gives you a pretty clear picture about where we're at in the state, different parts of the state as far as the health needs of different counties. So I'm just wondering what you think are some of the challenges and opportunities that face, the rural versus urban parts of the state when it comes to dealing with this virus.
Sure. Well, thank you, Madeline. It's great to be with you here this afternoon. And, when I think about my work in county health rankings and looking at the health of counties across Wisconsin, typically what people think is that rural areas are going to be the healthiest places, right? Clean air, open space, and good, clean living, right? And what we discovered when we actually ranked the health of counties based on a number of different measures of health is we often found rural parts of our state and states across the nation actually lagging behind some of their urban counterparts. So it just based on past rankings in Wisconsin, the lower ranked places tended to be in rural parts of northern and northwestern and some places in central Wisconsin, and Milwaukee County always ranked fairly low too. So we had both urban places and rural places. But some of the things that contribute to that certainly are socioeconomics. So sometimes jobs aren't as prevalent in rural communities, but other things that will definitely affect this virus. One is access to healthcare, and we know rural communities have less access than urban areas do. We know right now that testing for COVID-19 is definitely lower per capita in rural communities than it is in urban communities, and so that is really a challenge. On the other hand, we also know that when you have an infectious virus, it spreads more quickly when people are closer together. And so that bodes well for more rural parts of our community where people don't tend to live or work in quite as congested settings as they might in a more urban area like Milwaukee or like Madison. But clearly, as we're seeing throughout the state, any place where people work or live closely together can be just a prime place for this virus to spread. And that's part of what we're focusing on as we move forward.
Yeah, so with that, information in mind about how rural communities can actually suffer a little bit more from things like this, I just, want to get your thoughts on the call that some lawmakers have been making recently to, reopen the state in sort of a region-based way, to account for the fact that, there aren't very many cases in, the more rural parts of the state. I'm curious, with what you had just said, what what you think about that sort of approach.
Well, I think there's a couple of things. First of all, what I often say in public health is when you do your job really well, nothing happens, right? Because if you're focused on mechanisms that prevent disease and disease doesn't happen, people don't always make the connection to, oh, that's because we did this to stop it from spreading. And I think that's really true here as we look at COVID-19 and the actions that Governor Evers and Secretary Designee Palm took way back in March to see what was happening with this disease across the world, and to see that places that put safer at home orders like we did in place early saw much less spread of the disease. So what's tough to know about opening up regionally is if we did that, would we suddenly start to see the disease spread much more quickly in parts of the state where it hasn't yet? We have COVID positive cases in 65 of the 72 counties. And that means even in very rural places like Florence County and Iron County, Vilas County, the virus is there, or no one would have tested positive. And so it's a risk. It's a risk if we start to open up regionally and then start to have much higher flare-up of the virus in rural communities. And I know another thing, especially based on what I just said about healthcare, is the phenomenon we've seen in other parts of the country where if you get a sudden spike in a small rural community, you don't have the health resources to deal with this. Many small critical care hospitals don't have ICUs, and only have very limited beds. And so an outbreak of COVID-19 in a rural part of our state could overwhelm a community's health resources pretty quickly. But that leads us into, I know, some other things you want to talk about, which is really the importance of testing and contact tracing. And if I can just for a moment say why we keep talking about that. We know we can't all stay in our homes forever for 2 years while we wait for there to be vaccine created for this disease, right? I mean, we understand there are so many people who are suffering terribly. They've lost their jobs, or they're so lonely because they're living by themselves, or they can't see their family members and they miss them terribly. None of us like this, not one bit, including me. So as we get the curve to flatten, which we've done well here, and hopefully calm down the spread of the disease or prevent it from starting in the first place in some smaller rural places, we still have to be very vigilant before we open the door, because this virus is here and it is sneaky, and it will attack us if we don't watch for it. So that's why testing and tracing is so important. If we want to open our communities again, we've got to test lots more people. And it means, as I like to say, we've boxed in the people right now to keep them from spreading the disease. If we start intermingling again, we need to box in the virus. And the way to do that will be to test anybody who has any sign or symptom of the disease. If they are positive, they will have to quarantine for 14 days, and their close contacts will have to quarantine as well. Excuse me, the person with the disease actually isolates and their contacts quarantine. That's the proper language. But we have to just get to a new normal where you got a sore throat, you get a COVID test. If you're positive, you have to stay home. And so do your close contacts to monitor for signs and symptoms. And that way we'll box in the virus and we'll avoid having huge spikes in the future. And we'll be able to start to get back to a more normal way of life here in Wisconsin. So sorry, I know that's a long answer, but just kind of wanted to lay out that framework of where we see ourselves heading.
Yeah, no, I love long answers, so that is perfect. And I did just want to note, I had a question on here about how many tests you think that we should be doing, but Governor Evers actually answered that this past week. He set a goal for the state to do 85,000 tests per week, which averages out to about 12,000 tests per day. So it'll be interesting to see
That's right.
as things ramp up whether we hit that. But so I want to look a little
And
bit
just so you
at
know, that's oh, sorry, a
no,
little
you're good.
delay here. That's about 6 times what we're doing right now. We're doing, well, on a good day, we're doing close to 2,000 tests a day. Some days it's a little less, but so it's a pretty significant increase.
Right, right. Yeah. So turning to look a little bit at the gating criteria that the federal government released this week, and it calls for a downward trajectory of positive tests as a sign that things can open again. And I'm curious what you think about that criteria, if you think that that is specific enough, and who or where is Wisconsin looking to for guidance on, what sorts of things to set our own criteria for that downward trajectory.
Yeah, that's a great question. Before we released the Badger Bounce Back Plan, we were looking at a number of national experts who were writing about this and proposing different criteria. And so we looked at the White House's Opening Up America again. We looked at documents from Tom Frieden, who used to be the director of the CDC. There's a great document from the American Enterprise Institute that talks about the different phases of opening up your country, opening up the country again. And really, all of them were starting to center around similar, what we've come to call in the Badger Bounce Back, the gating criteria. And so we aligned very closely with the criteria that the White House had proposed, really seeing this as a national standard. And so just to be clear, it falls into 3 buckets. One is symptoms, and every state in the nation has something called syndromic surveillance for influenza. And I have to say, I'm very proud of Wisconsin. We have a very strong syndromic surveillance system. And what that means is you have clinics all across the state who are signed up to be part of our surveillance system. And every week they report to us how many patients they talked to or saw in their clinic who were reporting symptoms that looked like influenza. So things like fever, cough, body aches. And so we've expanded that system to not only track for influenza, but also for COVID-19. And this helps us have a sense of how are there people out there with the symptoms who may or may not have been tested. So that's one group, symptoms. The second group of gating criteria we'll look at is cases. And we'll be looking for a 14-day downward trajectory in both the people with symptoms through our surveillance system and with cases. Now, I've had a lot of people say to me, well, then if we start testing more people, we're automatically going to see more cases, and that means we'll never get out of this. But we're going to look at it as a percentage of positive based on the number of tests. And so we want to see a downward trajectory in that percentage, because we do know if you test more people, you will have more cases. But right now, we've been right around 9.5% to 10%. If we can see that starting to creep down to, from 9 to 8 to 7, it'll show that the virus is starting to cool down a little bit in our state. And then the third set of gating criteria, and we're working on exactly what we'll measure here, is are our hospitals ready for a surge? Because one of the things we know about pandemic influenza or pandemic coronavirus, is that we run a really high risk of it coming back. And so we want to make sure, even when we open up, that our hospitals are ready for that surge. And so we are working with our hospital partners, and we'll be helping to co-create measures that we can all agree on that would help us understand, are our hospitals ready for that? One of the specific things we'll look at is the percentage of healthcare workers, or the rate of healthcare workers being infected. And that will also give us, that's a really good sentinel, because our healthcare workers, you just can't say enough about them, that they are putting themselves at the front lines of this and being exposed to it over and over again. And, when we start to see lower rates of healthcare workers being infected, that will also be a good sign for our dear healthcare workers, but also that the virus is less present in the community. So one last thing I want to say about that is, so people hear 14-day decline and they're like, well, does that mean you start again if there's one day with a blip? And we're working with our data analysts on that too, because there's a lot of science around statistics, and we want to look at trends over time, not individual days. And so there are ways to account for a blip one day that don't mess up your whole trend, to put it in lay terms. And so we'll be looking at ways to measure those trends over a 14-day period using rolling averages and things like that. And we'll be putting up a dashboard with indicators of how well we're doing on each of those as we move forward.
Gotcha. Well, yeah, that is good to know, because I was just about to ask you about that, about whether a blip would send us back to day one every single time. So good to hear that it's a general. Yeah, that's good to hear. So to come back to, the physical process of testing, obviously we've ramped up our capacity quite a bit, and there are a bunch more labs testing now with a much increased capacity. And I know that we have programs to get more PPE and, the collection kits, but I'm wondering specifically on the, lab side of things, because I know that things like reagents and those types of chemicals are, pretty short. And I'm just wondering how the state plans to acquire more of those necessary ingredients to run more tests, knowing that there's not an infinite supply of them anywhere out there.
Absolutely. Yeah. Part of the challenge with this virus is it's affecting the whole world, right? It's not just affecting Wisconsin. It's not just affecting the United States. It's affecting the whole world. So everybody wants to test at higher rates until we have vaccine that will ultimately protect us from this this terrible virus. So the supply chain is a challenge. We are lucky here in Wisconsin. We have a company called Promega that makes reagent, and I don't completely understand the whole mechanisms of testing for this. So let me just say, I'm about an inch deep in knowledge here, but what I understand is that some labs use testing where all the reagent is pre-mixed, and other labs can use bulk reagent and mix their own. And so Promega makes bulk reagent and has been really helpful in standing up several testing labs in our state by providing that bulk reagent, so that I think we have a little bit of a leg up on some other places. But this will be really critical to continue to work on those supply chains. We know that America is a place with great ingenuity, and so I am trusting that businesses and industry are figuring out solutions to this as well. We know that there are a number of new technologies coming out in terms of testing. We're in, as with anything, anytime there's something new, there has to be a certain amount of rigor to be sure it's working well, and that you're not doing tests that are giving you either false positives or false negatives. Either of those things is really bad in a situation like this. But I'm really hopeful about the number of entrepreneurs who will bring more testing capacity to us in more ways very quickly.
Yeah, definitely. So turning to the second phase, turning to contact tracing. So once you know that someone has a positive case, you can conduct the contact tracing and identify who they've seen in the last couple of weeks and reach out to those people to also have them monitor for symptoms. So I'm just curious about before this new coronavirus, how much contact tracing were health departments doing in the past, and particularly, were they doing it ever, at the scale that it is right now, that we think we'll have to be doing it in the near future?
Right. Well, contact tracing is done by our local public health partners every day. There are over 50 reportable diseases in the state of Wisconsin, and anytime there is a reportable disease, well, I shouldn't say anytime. Some of them don't require contact tracing, but many of them, based on the infectious nature of them, require the same kind of work day in, day out. One of them I think is very common, and we've had a number of outbreaks over the last few years, is pertussis, or whooping cough. It's the exact same process you go through when you have a pertussis case, to interview the person or the parents of the child with pertussis, and then find out who the close contacts are. The difference is oftentimes you can give them medication to prevent them from getting the disease. We obviously don't have that luxury here with COVID-19. So it's something that our local public health colleagues do day in, day out. But you're absolutely right on the money. People have never done it at the scale we're talking about doing it. If we are doing 12,000, we were just working on the math on this, 12,000 tests a day, or we were doing it weekly, 85,000 tests a week. If about 10% of them are positive, which is where we are today, that means 8,500 contact interviews. And once people start to go out and about, the average number of contacts they have is at least 5. And so that's another 42,500 people to interview per week. So we're talking about interviewing over 50,000 people per week. So that's a pretty huge increase. And what we've already seen is some of our local health departments, understandably, have been overwhelmed by the surge of COVID patients. And so here at the state, we have begun to supplement their great efforts with people who do contact tracing here. And it's a really great story, I think. Naturally, you'd think in our Division of Public Health, there would be a lot of people we could retrain pretty quickly who don't do that in their normal daily job, but they've got the background knowledge and they can quickly adapt to that. And so we pretty quickly stood up about 100 people within our Division of Public Health, which is a division of about 400 people, to do the contact tracing. But now we've reached out across state government. And so we have employees from the Department of Natural Resources, or the Department of Children and Families, or the Department of Administration, who we've brought through an orientation course and are starting to do this kind of outreach and calls. And it's just a really great show of support across state government, to everybody pitch in and help across state government, help our local partners, so that we can box in the virus and prevent spread from person to person, and tamp this down so, again, we can all get back to more normal life.
Right. Yeah. How many how many people do you think in all, I mean, if you're going to be testing over or contacting over 50,000 people per week, how many workers do you think in all that the state will need to be able to pull that off?
Well, we've set 1,000 contact tracers as our goal. As I've said, we've already started to ramp up people to do this, because we're all, this isn't something like we're going to start. We are already doing it. with the number of positive, the nearly 5,000, we're up to 4,800 and some cases as of today. So every one of those cases, we've been already doing this work on. But there's a lot of things that we have to account for. Will the rate of positive cases stay the same? We're hoping it will go down. Will our testing go up? Yep. And so, rates might go down, but numbers might go up. So we need to be nimble and flexible. And along with that, we need to look at technology to assist us with this too. And so in addition to thinking about how we're going to train over 1,000 people across our state to do this kind of work, it is also how might we be able to use technology to do some of it. Could we do some of these interviews and contact tracing through people going onto a website and filling out the pertinent information, or through texting? It's also an opportunity to think about how we can use technology to check in on people who are in isolation and quarantine, see how they're doing, see if there's any needs they have, and how we work with people in local communities then to meet those needs.
Yeah, absolutely. So I did note that I think on a recent version of the patient form that providers can fill out when they think a patient has coronavirus, that some people are now getting identified as presumptive positives, just because our testing, while it's increasing, isn't there yet, and so they've reported like relevant symptoms to their doctor, but they won't get a test for it. So I'm wondering, do those people also get did they go through the process of contact tracing, or is it only for people who get a confirmed positive test?
Nope. If a physician refers or fills out that form and reports someone as a presumptive positive, which we've actually required now as part of COVID-19 being a reportable disease, they get the exact same kind of contact tracing as if they had a test and were positive.
Okay, gotcha. Yep, that makes sense. All right, well, I have some viewer questions for you that I'm going to throw at you. Just a couple. I did get more than I can ask, so I'll squeeze in a couple. But so one is from a viewer named Jen, and she is asking, once the healthcare workers recover from COVID-19, will they be able to go back to work and work on the front lines risk-free?
That's a great question, Jen. We had hoped that would be true. But what we're finding is that while after you have COVID-19, you do have antibodies for it, it is not clear that everyone gets enough antibody in their system to prevent them from getting reinfected with the disease. And the other thing we don't know is, again, because this is novel, brand new, is how long it will last, that antibody protection. So healthcare workers can certainly recover and go back to the front lines, but we would still want them to be using personal protective equipment to protect themselves against potential reinfection.
Yeah, it is. I mean, it is tricky with it being so new. I've been watching reports of, people out of Wuhan who were tested negative and now are testing positive again. And so, yeah, I can imagine it's really difficult when you really don't know what the outcome is going to be, for sure. Okay, we also have one from, and she is asking, at what point is it realistic to expect that some medical clinics will open where it would be easier to do social distancing, such as things like counseling?
Yeah, that's a great question too. And I think, I have to tip my hat to all of the different providers who have been working on how to see their patients and how to do patients over video or telephone. But I know, especially when you need counseling for your mental health, it's not the same as being in the room with someone. And so I can't give you an exact date when I think that will happen, But I think, again, if we look at these gating criteria we've talked about, as we start to see reduction in the transmission of disease and the symptoms, I think we will start to see healthcare organizations opening up to see more of their patients who need regular care. And we know there's many people out there who have been deferring care, whether it's for behavioral health or for chronic conditions. And, we don't want that to go on too long, but we will continue to need to do things safely. And so I think as we move forward, um, we'll have to get used to seeing each other's eyes and not our faces, because we'll be wearing face masks, which will help prevent the spread of disease. And we'll see fewer patients in a waiting room. Appointments will be more spread out, so there won't be as many people in the waiting room, so we can stay farther apart from each other. And these are the kinds of steps and adaptations I think we'll make that will help us start to get back to more normal, but yet still protect us from spread of the disease.
Yeah, absolutely. And then one last question that I wanted to squeeze in from a viewer, but something that I also wanted to ask about is that, we're still, even now, hearing reports from people who have asked to get a test from their provider and they've been turned down for it. And the viewer had asked, should this still be happening? And I guess I would wonder, why is that happening still, given that we have increased capacity? And, do you think we'll ever reach a point in the state where truly anyone who needs a test will for sure get one?
Yeah, I hear you, and I've heard these same stories myself. So a couple of things I want to say about this. First of all, when the virus first hit our state in February, early March, we didn't have any testing. Every test had to be sent to the Centers for Disease Control in Atlanta. And then around the early part of March, our state lab of hygiene in Madison began to test. And every test in the state had to come down here. And so we only could do a few hundred tests a week. And so we had to be really, really strict with healthcare providers about which patients under which conditions could get a test. And so they've been great. They really honored that and tested only the most symptomatic, the most frail, the people who'd been in contact with people with COVID, and our healthcare workers. And so this is a big shift, because now, a few weeks later, we're saying, hey, now we have lots of tests, test everybody. And so it's kind of like, which message do we want them to honor? The other thing that I want to say is it's a big mind shift for healthcare providers too, because during normal flu season, one of the things every clinical provider knows is, if you're not going to do anything different in your treatment, if you bring the patient in and see them and diagnose them with influenza, then if they stayed at home and you dealt with those symptoms over the phone, don't bring them into the clinic, because you don't want them transmitting influenza to everybody else. And so providers very much are thinking about that in their own clinics. We don't want people coming in with COVID into our clinics and transmitting it to everyone else. And so that's a very logical clinical approach to this. However, we're asking providers to think not like traditional medical providers, but think like public health professionals. And we need them to test everybody so we know who has the disease, and we can have them isolate and quarantine. So it's a real mind shift in providers' minds. And the last thing is, and it changes clinic flow, because you do not want people who might be sitting there with COVID sitting next to the person who's there to have their diabetes checked. So you have to think about how you do different flow in clinics. And the last thing is, when, this is a nasal pharyngeal swab. So a swab you stick way up your nose, pull it out and droplets get in the air. So anybody conducting the test needs to have that N95 mask on to protect themselves. And as you've heard, we have shortages of PPE. And so sometimes the doctor might be saying, don't come in, I don't have enough PPE to be doing tests. So these are all the reasons that's happening. We're working on a number of ways to combat those reasons. We're trying to get more PPE. We're also working with the National Guard to set up a number of mobile testing sites around the state. So clinics could say, don't come into the clinic, go to this site where the guard will be stood up to do your testing. But those, again, will be periodic. We have 11 teams of Guard members who can do this. Wisconsin's a big state. 11 teams is a great contribution, but they won't be able to be everywhere all the time. So those are all the things we're solving for on this, getting to the point where everyone who needs a test can get a test. And we'll get there. We're strong people here in Wisconsin, and we work together and we solve problems. But I do understand we're not quite there yet.
Yeah. And I mean, as we've said, with a rapidly changing situation like it is, just changing by the minute every day, it's hard to keep those messages and do that. But yeah, I certainly hope that we can get to that point as well, for sure. Well, with that, I think we will wrap it up. But Julie, thank you so much for joining us, and thanks to all who are watching for tuning in. This show will be back next Wednesday. But in the meantime, you can watch the Coronavirus 5 in 5, which is a rundown of top headlines every day at 3 p.m. or 3:30 in the afternoon, that it can catch you up on everything that you need to know about what we're writing about day to day. But until I see you next, hope you stay safe and healthy, and thanks again for watching.